Do you know how to properly measure your blood pressure? No? Well, you're in luck because today, we're going to learn just that. Blood pressure is the force that your heart exerts on the walls of your arteries as it pumps blood. It's a critical component of our health, acting as a barometer for our cardiovascular well-being. Regular monitoring can help detect issues early and allow for timely intervention. So grab your blood pressure monitor and let's dive right in. Now, before we get started, you need to understand your blood pressure monitor. This device is your personal health detective. It's compact, but don't let that fool you. It's packed with functionality. First off, the cuff. This is the part that wraps around your arm. It inflates to restrict blood flow, then deflates, allowing the monitor to measure the force of your blood flow. Next up, the monitor display. This is the face of your detective, where it reveals the secrets of your blood pressure. It shows two numbers, the systolic and diastolic pressure. We'll get to what those mean later. Some monitors also have extra features, like irregular heartbeat detection or risk category indicators. These can give you additional insights about your health. Remember, every monitor is slightly different, so it's always good to read the manual that comes with your device. Now that you understand your monitor, you're ready to take your blood pressure. Positioning is key when taking your blood pressure. Get it wrong and your readings could be off. Let's dive right into how to position yourself correctly. First off, finding a comfortable chair is crucial. You'll want to be seated with your feet flat on the floor and your back supported. No crossing your legs either, it can affect the reading. Next up is your arm position. Rest your arm on a flat surface, ideally a table, so that it's at the same level as your heart. Your palm should be facing up and your arm should be relaxed, not tensed. Now let's talk cuff placement. The cuff should be placed on your bare upper arm about an inch above the bend of your elbow. Make sure it's snug, but not too tight. You should be able to slide 2 fingers underneath it. With the correct positioning, you're ready to take a reading. Now, the moment you've been waiting for, taking your blood pressure. First things first, let's get your monitor ready. Turn it on by pressing the power button. Most monitors will have a small screen that lights up with numbers and symbols, but don't worry, we'll decipher that secret code in a bit. Next, it's time for the cuff to step into the spotlight. Wrap it around your upper arm, ensuring it's snug but not too tight. You should be able to slide 2 fingers underneath. Once you're all set, hit the start button on your monitor. You'll feel the cuff inflate, a little squeeze play going on there. Don't worry, it's not trying to start a wrestling match, it's just doing its job. As the cuff deflates, the monitor will start displaying your blood pressure reading. You'll see 2 numbers like a tag team. The top number, or systolic pressure, tells us how much pressure your blood is exerting against your artery walls when your heart beats. The lower number, the diastolic pressure, shows the pressure when your heart is resting between beats. And there you have it. You've taken your blood pressure reading. But wait, don't just walk away now. These numbers are not just for show. They carry the secret story of your health. Interpreting the readings is a crucial part of the process. And voila! You've successfully taken your blood pressure. But remember, interpreting the results is just as important. So you've taken your blood pressure, but what do those numbers mean? Your blood pressure reading consists of 2 numbers, usually written one above or before the other. The top one is your systolic pressure, which measures the force your heart exerts on the walls of your arteries each time it beats. The bottom one is your diastolic pressure, representing the force exerted on the artery walls when the heart is at rest between beats. A normal blood pressure reading typically falls below 120/80. If your reading is consistently above 130/80, you may have high blood pressure, also known as hypertension. On the flip side, a reading consistently below 90/60 might indicate low blood pressure or hypotension. Don't fret though. Blood pressure can fluctuate throughout the day due to factors like stress, diet, and physical activity. But if you notice a consistent trend, it's time to chat with your healthcare provider. Now you're not only able to take your blood pressure, but you can understand what it means. Congratulations!